with 7 more that are pending prosecution. And our first product has a 510(k) regulatory pathway and has established CPT codes for reimbursement. So the technology platform that Jason and his co-inventor at UT Dallas have been working on is the ability to use semiconductor manufacturing processes to lithographically pattern metal electrodes onto a proprietary softening polymer. And because we're able to leverage this proprietary material, we have the ability to revolutionize the property paradigm that should be expected from spinal cord stimulation leads. Every incumbent lead today is some simple derivation of hand-assembled electrodes onto a molded silicone. And what that means, of course, is that they all have the same limitations. Chief among these limitations is thickness and size, with the minimum device thickness being around 2 millimeters. And this gets to one of the key problems within spinal cord stimulation, which is the amount of space that's available in the thoracic, in the epidural region to implant these devices. As you know, there's 2 primary placement points in SCS. You have the thoracic region for lower back and leg pain, and then you have the cervical region for chronic neck and arm pain. Well, in the thoracic region, you have about 5 millimeters of space if there's no scar tissue or other obstacles. But in the cervical region, you only have about 1.5 millimeters of space. So you're talking about a neurosurgeon performing a laminectomy, laminotomy, and trying to shove a 2 millimeter device into 1.5 millimeters of space. And the inherent risks and dangers that are associated with such a procedure are reflected in the number of cervical placement procedures that we see in the market, where cervical placement is only about 10% of all STS procedures, despite the fact that chronic neck and arm pain is about 40% of all chronic pain. Another key problem in SCS is battery life. As you know, for the devices that are not rechargeable, there's a battery that's in the implantable pulse generator that's implanted in your flank. Those batteries last somewhere between 3 and 5 years. Some people say 10 years. Most people know that that's not the case. And then at that time, the patient has to return for surgery, have have that battery replaced, further increasing the amount of risk they're exposed to, increasing the costs, and increasing the patient burden. So Backstop Neural's solution to these problems are devices that are 10 times thinner and have the potential to double the battery life. The way that we double the battery life is twofold. One is through that proprietary softening polymer, which is rigid at room temperature and becomes very soft and conformal at body temp. And that means that it conforms directly to the spinal cord, delivering that current more efficiently. The other piece of it is the type of metal that we use, which is a titanium nitride, and has 10 times the charge injection capacity that you get from platinum iridium. So we spent an enormous amount of time interviewing physicians in this space, everything from pain interventionists to neurosurgeons to orthopedic surgeons, all with the intent of confirming that these are indeed problems that they face on a day-to-day basis and that they are looking for solutions to these problems. So we do compete very well on the thinness and also the conformability, but we also compete on a range of axes against other companies that are working in this space. So our first device is a thin film-based paddle lead that would be delivered through a laminectomy, laminotomy, but we are also working on a percutaneously delivered paddle lead along with a fully integrated SCS system that includes a miniaturized implantable pulse generator. And then further out, we're working on motor recovery devices because of the amount of contact points that we are able to place onto an electrode. So the marketplace, as I said earlier, is about a $7 billion market opportunity when you include chronic pain and chronic neck and arm pain, as well as motor recovery. Everybody knows the players that are in this space. We don't view ourselves as competitors to them. We're looking to leverage them as strategic partners. We are only working on these electrodes in the near and intermediate term that would then be connected or adapted to the implantable pulse generators. We are not naive. We understand the challenge that we face in developing that type of strategic partnership, but we are happy to see that there are a range of new entrants into the marketplace, all looking for ways to differentiate their products. The leadership team has educational backgrounds from institutions like Georgia Tech, MIT, and Columbia. Collectively, we have 10 rounds of capital raised for past startups, We've launched more than 20 new products into the market, and we have 4 successful exits between us. Our regulatory and reimbursement strategy, we've brought on CROs to help us with our regulatory and reimbursement framework. We've also been able to recruit some key figures onto our advisory board, including Dr. Peter Statz and Dr. Stephen Fulowski. We are currently raising $6 million to get us through a commercially ready product by 2027. I was hoping to walk in here today very jubilantly.
Low battery, please charge.
And tell everybody that we had closed on our lead investor and be able to describe that deal. Unfortunately, I haven't gotten that paperwork yet, so that'll have to wait to the next one. But we are very close on pulling in a lead investor into this round. And we did actually close or were awarded a phase 1 SBIR to get our lead through some large animal studies. And just in time for the battery run out.
Hey, thank you, Colin. It was a great talk. What I think is promising about your approach here, I mean, I'm sure you were here when Ray gave the talk about, hey, you don't want to be the number 5 player in a 4-person market, but your strategy is you're not necessarily trying to displace these firms. You see them as potential partners. My question to you is the risk that Ray brought up, where, let's say he's having a conversation with Medtronic and they're collecting intelligence because maybe they see you as a threat. How do you assess the risk that one of these strategics might be sniffing you out to see what they can do to basically accomplish the same thing in-house?
Right. So with a baseline of all your traditional non-disclosure agreements and everything that you would put into place, obviously knowing which organizations are more likely to do that type of thing. Ray talked about the ones that maybe operate with a little more integrity. Maybe you're more open up front and keep a little bit less close to the vest. And then with others, you don't disclose as much and you feel them out. I think we had a pretty good understanding that at this stage, we're only going to get so far with these strategics. We don't have large animal studies. We do have small animal trials. We've had devices in rats for up to 6 months, but we know that until we've demonstrated biocompatibility of the full device, and we've got some large animal studies and maybe even some animal or human trials, they're really too far forward with us. So we don't risk too much upfront until we've got that.
Okay. Is there the possibility that you could have either licensing deal or some kind of partnership with more than one strategic partner?
I think probably not for one individual product. We'd love to be able to do that for separate products that address maybe different spaces like the motor recovery versus
motor recovery. You're talking about the neurorehabilitation.
That's right. Yeah.
Okay. And they're one of the but one of the observations that we've heard from early investigators doing epidural stimulation to restore function after SDI, for instance, is that off-the-shelf leads, if I'm cutting it for restoration. So you have the ability to customize, for instance, to go across columns for that particular application.
You mean customized per patient?
No, customize per indication.
Right. Yes. Yeah. Absolutely. Yeah.
Okay. Questions from the audience? All right. If not, I want to say thank you very much, Kyle.